who is with us from Temple University as she's earning her degree in music therapy. And today she will be presenting on music therapy in the neonatal intensive care unit. So please welcome Yen.
Hi guys, welcome. I'll be presenting my in-service at music therapy in the neonatal intensive care unit at Mount Sinai West, based on my work there. These are our lovely staff. I'd like to introduce you to our team. We're consisted of 6 music therapists, 1 MD, and 1 nurse practitioner. These are our staff and their credentials. So this year we have 14 interns, 1 research scholar, and 2 fellows. These are our lovely interns, as well as our research fellow and research scholar. So a little bit about the Louis Armstrong Department of Music Therapy. We are a 27 years clinical service, and we are heavily based on research. We have different programs across the Mount Sinai campuses, and we are currently having 7 RB clinical trials. We're also co-PI with lots of MDs and RNs. And we provide music therapy from the beginning of life, being the NICU, through end of life. We also have an outpatient service at the Union Square Mount Sinai, and we also hold annual gala. So our department started inpatient in 1994, and then we extended outward to outpatient in 2001 until present day. We provide music therapy service to lots of population listed down below. I'm not going to read them all. It's a lot. And in our department, we don't just focus on clinical care. We also focus on 4 different areas, being outreach, research, education training, as well as marketing and fundraising. And that's how our department was built. So what is music therapy? I'm not going to read the definition from the American Music Therapy Association because I'm pretty sure all of us here, we're quite familiar with the term music therapy. But I would just like to point something out. So music therapy, it is performed by a licensed and board certified music therapist. We went through specific trainings at either bachelor's or master levels, and all our interventions, they can be backed up with immense amount of research. Next, the definition that I myself like to use is the evidence-based use of music to meet non-musical goals. And it's because oftentimes in hospitals, the goals are non-musical. And now NICU music therapy. The model that we use, first sound, rhythm, breath, lullaby NICU model, we work in 3 different prongs, being the infant, the environment, as well as the caregiver. We have specific goals for each prong, and we also address the intersection between the 3. So we could have interventions that facilitate needs for both the infant, the environment, and the caregiver at the same time, or 2 prongs at the same time. And I would also like to say that the RBL NICU model, it's the only NICU model that incorporates the caregiver, the parents, because we know that ultimately bonding supports the infant as well. Our model is also a global and international model. It's been used not just in the States, but it's been used in many different countries globally. Next. So for our model, we really stress the importance of live music because we believe that live music, it is the safest and allows for entrainment, which ensures the in-the-moment adaptation to avoid overstimulation. And that's why recorded music risk is the overstimulation. And live music, it also allows room for us to entrain to the baby's heart rate, respiratory rate, and other moments of transitions. And furthermore, I would like to point out that live music enables us to tailor interventions not only to the specific needs of the infants, but the needs of the caregivers as well, because Every family is different. Every baby's needs is different. We also come from a music psychotherapy orientation. So we really foster the relationship between the patient and the therapist. And the way that we practice this is orientated from the medical psychotherapy. So we work in holistic view. We take the physical, emotional, cognitive, social, and spiritual aspect of the patient into consideration. We're also trauma informed, which means that we consider possible trauma and triggers that could be related to the illness, hospitalization, and the music itself, because anything could be a trigger, and we're mindful of these potential triggers. We're also wellness focused, so we looked beyond reducing physical symptoms, pains. We look at the patient as a whole person that has a life story, and we focus on the overall life quality, not just to the illness itself. And last, we're also multicultural perspective. We also incorporate multicultural perspective. And again, the NICU model, it's currently being used internationally. And another example would be Song of Kin. It can be done in any language, any culture, and it can be adapted into any country. So a little bit about the kit that we use. The instrument right here, it's the ocean disc, and it is intended to resemble the fluid-like whooshiness of the intrauterine environment. And we created this instrument with Remo, which was designed specifically only for the RBL interventions in NICU. And Ocean Disc has a more muted sound in comparison with the Remo Ocean Drum. It's also a sound that babies are familiar with because it's a sound that the mother already has. And next we have Gottlebox right here. It is based off of the first sounds a human being experienced within the womb, which is the sound of the mother's heartbeat. And it's created for soothing and to enhance sucking response. We also use voice. We use voice to provide an atmosphere of safety, which induces sleep and relaxation. And there's a quote that I personally really like. It is a blanket of tone to soothe and hold. Last but not least, we also use an acoustic classical guitar with nylon string. And the reason being nylon string, it offers a softer timbre. And also the guitar, it lends itself to offering convincing musical experience that reflects the infant and caregiver's needs. And most importantly, all these instruments, they are infection control improved, which is very crucial at the neonatal intensive care unit. So we also provide training. This is our RBL NICU Music Therapy Training Program syllabus. And although this year, because of COVID, we were still able to adapt it and we provided this training via Zoom. And this training program is divided into 3 parts, 3 tiers, and all trainees are expected to pass this 160 hours of vigorous training program. And it doesn't just cover music therapy knowledge, but as well as psychotherapy education and medical knowledge about the NICU. The training is also an international training, so we have trainees from all around the globe, including Japan, Taiwan, Korea, Egypt, Barcelona, Spain, and many other more. So you might be wondering, who can make a referral? So referrals can be made by nurse practitioners, patient care manager, social workers, nurses, neonatologists, child specialists, music therapists, music therapy interns, or parents and families. Which brings me to my next slide. Reasons for referrals. So some possible reasons for referrals might include support for parent and sibling, as well as bonding for parent and infant, or babies that have difficulties coping due to irritability and crying. Some other reasons could be feeding support, sedation, or developmental stimulation. And it's our department policy to only provide music therapy for babies that's over 32 weeks. And for baby that's under 32 weeks, we need approval by a neonatologist on a case-by-case basis due to an increased overstimulation from our research. And now I'll be talking about the goals for the caregiver prong. So we would be working on parent support and emotional support because it's quite apparent that many families at NICU they experience stress, trauma, and anxiety due to their infant's hospitalization. So we would help them process trauma or other emotional issues in individual care sessions. We also seek to encourage the parent in bonding support by supplying a tangible way for parents to connect with their babies through either songwriting, creating, or singing familiar lullabies or family songs. And this focus on affirming their parental roles as well as providing coping and resourcing for the families. We also provide support for the families, including siblings and fathers, which are a seemingly marginalized community at the NICU. And now the goals for the infant prong. We provide soothing support by creating a womb-like environment through sound and music and other music therapy interventions. And music therapy has been shown to deepen infant sleep state and support infants to self-regulate. We also work on goals such as developmentally appropriate stimulus, and we assist in respiratory support by stabilizing breathing and heart rates, which enhance parent-infant bonding, and we also reinforce feeding and sucking rhythms, which helps with weight gains. Moving on to the environmental prong. So we use environmental music therapy as an intervention to support the environment with possible monitor fatigue, caregiver burned out, or staff burnout. And we do this by bringing a certain aesthetics and holistic experience into a seemingly sterile medical setting. And this could really modulate the perception of the hospital experience and really ease the healing process. And I remember this time I was singing My Girl at the unit and along with other songs. And after I sang the song, this mom, she came up to me and she told me that while I was singing My Girl, she had a boy and she said she was singing My Dude to her baby, and it was so cute. And she said she got a little bit emotional. And later I introduced service to her. So it really shows that music brings a certain context, certain extent of comfort via familiarity in an unfamiliar setting. And this is Dr. Andrew Rossetti here at the NICU. He wrote an amazing article about EMT. And I would like to point out that there are studies that measure EMT's impact out there, but Dr. Rossetti's article is the first that provides detailed actualization of the steps, of the orientation, and guidelines of how it should be implemented. So if you would like to read this article, you could reach us at the end of the presentation. And next, moving on to interventions, these are the list of the interventions that we use. So Song of Kin, it is a parent-chosen lullaby or a song that's significant for the family's culture, and it could be in any culture or language. Song of Kin can be utilized to foster an ongoing music psychotherapeutic relationship during bonding or parent support. Next, for tonal vocal holding, it is the use of voice on different vowel for a specific region of the body. We use a simple elongated tone as means of stability for infants. We select vowels in accordance with the needs of the babies. For example, the tone ah, it resonates within the heart in the lung region, and therefore this may be best suited for infants with irregular heartbeats or when respiratory distress is apparent. Moving on to ocean disc. It's an intervention we use to match and entrain to the infant's breath with the goal of stabilizing the infant's respiratory rate, as well as maintaining a quiet, alert state, or we use that to induce a sleep state. And sometimes we use it for parent support as well because parents they find this sound soothing, relaxing for them. And next we have Gottobox. We use it to regulate suck, swallow, breathe patterns, and we use it for soothing as well. Last but not least, we have Heart Song as an intervention. This is one of our newer interventions that was brought to our department earlier last year. And Heart Song, it involves the recording of the baby's heartbeat, and then we fold that into the caregiver selected song of kin. And when it's completed, the heart song gets sent to the parents or the caregiver as a legacy that they could hold on to, or a memory for them. It can be used for anticipatory grief, parent family support, enhanced coping, bonding support, as well as palliative, so critically ill neonates. And additionally, this can be a form to enhance coping for parents or caregivers that cannot be present in the NICU. So I'll be presenting my case study. And just a side note, you might recognize this family, but just be mindful of I'm using anonymity for confidentiality reasons. So if you do recognize them, just want to let you know. So baby Luca, when he was first referred to music therapy, he was 24 gestational age, and his current gestational age is 39 and a day. His diagnoses include extreme prematurity, low birth weight, anemia, apnea, bradycardia, jaundice, NEC, RDS, and neonatal thrombocytopenia. His current hospitalization stay is 3 months, and the reason for referral is that Luca was referred by the social worker for parent support. And some psychosocial history about this family. So both the parents, the mom, Rita, and the father, Juan, they're both from Peru, born and raised. They are first-time parents, and they have a really strong connection with their Catholic background. Both parents met in Spain while they were doing their master's in architecture, and they recently returned to work a couple weeks ago. And before that, they used to spend the whole day at NICU, so it was a really big transition for them to return to work. So this is our therapeutic progression, and I'm not going to go into detail into each session because that's going to be a lot. But I would just like to point out some sessions that seem significant. So the family, they have also received treatment from our team, but I'll just be presenting my part. So I worked with mom first, doing music during baptism at bedside. And I'm very fortunate to have slightly more time with this family, being that we can be assessing, treating, and providing closure in a session, and that oftentimes happen in a hospital-like setting. So this has been a really special case for me to be able to follow them for so long. So our first encounter, session 1, was when I provided parent support. At that time, they were unsure about baby Luca's outlook because he was really small and he was only 24 weeks. So the parents decided to get baby Luca baptized as soon as possible, and also for that, additional spiritual support. So I provided some environmental music therapy at bedside with the Song of Kin that mom identified with, which we discussed before baptism. And moving forward, throughout our therapeutic progression, I provided music therapy interventions for Luca and parent support by offering music-assisted relaxation, as well as empowering the parents and through bonding support and other intervention. There was one session that really stuck out for me. It was in session 6. While I was providing Song of Kin during bonding support, and mom was providing kangaroo care for baby Luca. So after Song of Kin, during our verbal processing, mom said that while I was playing the song, she was thinking about when I first sang it during baptism and how small he was. But now he's grown so much, and she's at the beginning she wasn't sure what the monitor means, what the heartbeat means, but now she has like a general understanding of if this monitor goes off, what it means. And also, baby Luca grew from like this small to this small, so it kind of she was kind of reflecting back to Luca's journey, and it shows music as a really unique means to capture memories and carry emotional meanings. Next, it's the session goals that I planned for both parents and baby Luca. So the goals for the parents were primarily parent support, emotional support, that focuses on increasing self-expression, increasing comfort, as well as self-agency. We also worked on fostering parent identity and through resourcing and coping. We also worked on bonding support. As for Luca, the primary goals were soothing, increasing bonding, and we worked on soothing to kind of create that stable sonic environment, using a blanket of tone to hold and soothe Luca, which eventually helped with his weight gain. And for bonding, we use the parent identify song of kin as a bridge from the caregiver to the baby, played in a predictable manners, and to kind of strengthen that cultural belief and values, which helps with both overall health and healing. And we also worked on enhancing brain development, through and tolerance to touch, as well as self-regulation. And this is a recording that I was really fortunate to be able to capture. This was one of our bonding support, and I'll be seeing their song of kin and mom's providing skin to skin. And later there's going to be a little bit river processing. So let me start playing. Just relax a little bit.
Me encanta.
How was that? ¿Cómo fue?
Hermoso. Hermoso. Una conexión. Y la música perfecta.
Exacto. La música y la emoción y cómo se forma un enlace.
Una conexión.
¿Qué estás pensando?
Como que me envuelve una fuerza.
Una fuerza entre tú, Paquito. Puedo sentir que eres muy fuerte.
¿En serio?
Ajá. No sé, es como cuando estamos en este ambiente y cuando te tocas y la manera como le tocas es muy bonito, muy lindo.
Qué perfecto. Justo hoy día encontrarte. Que estés aquí, pase esto. Es maravilloso.
De hecho, Mount Sinai es uno de los mejores NICU neonatalidad que está porque estoy en otro lado de Manhattan.
También.
En NICU, Mount Sinai East.
Yo también fuimos porque lo operaron de los ojos a Paquito ya. Y estaba súper ocupado. Muchos bebés.
Exacto.
Enfermeros, doctores, doctoras.
Aquí es, no sé,
tranquilo,
más tranquilo,
también privado.
Exacto.
Recuerdo que Paquito tenía 3 vecinos cerquita.
Oh. Too close. Here is definitely a better place.
Yeah. 100, I told you.
Oh.
100?
It is 100.
Yeah.
What does it mean?
He's breathing perfect.
So have you breastfed that?
Huh?
Oh, no. So that was a session, and it was interrupted because the RN had to come in for some care. But so this is a therapeutic process for the patient, and it kind of shows their revolution as a caregiver and how they found comfort in the NICU. And this also includes them stepping into their parental role and resourcing as I support them throughout Luca's hospitalization process. And I will analyze the therapeutic process with a statement that seems pertinent, along with the theme and the latent content, which is the psychotherapeutic understandings of what's being processed. And starting from the first session, I wish I could just do that for him. So it's a sense of guilt. It kind of reflects a sense of guilt because sometimes when we come in as professionals, the parents, they can't even hold their baby or carry their baby, and they have that urge to provide care. And oftentimes we see this come out during sessions. Shifting from the first statement, the parents now feeling progression towards closeness, also feeling comfort with the baby. She is also encouraged to sing their Son of Kin, which is the one that I sang to soothe Luca, which gives her a sense of agency and control. As we continue to provide care and the parents getting used to the NICU in the second half, she experienced a lack of safety. She said, whenever the monitor goes off, my heart drops, regarding a sense of fear. But Mom Rita, she was able to find her identity and her power as a parent later on, which continued into our fifth session. When he forgets to breathe, I remind him by calling his name or touching him. And this really enhances her parental role. And now that she's able to find ways that she can provide safety for Luca in both inside and outside of music, which really enhances her role. And now that she discovers her parental role, of course some questions might come up. Do you know he knows that's me? But this ultimately resolves into growth and comfort by reflecting their growth with the progression of time. And next, for my own therapeutic process, we like to say that you are the mom, or you're the dad, you're the expert in Luca, not us, to kind of support parent agency and affirm the parental role. And we also offer supporting via the parent chosen song of kin to kind of support that agency furthermore. We also like to provide verbal processing such as he knows your voice over a stranger's, over ours, to encourage them to utilize their voice that helps with identity and empowering their parental role. And mom, she also mentioned about listening to guitar as a form of self-care because dad, he plays a lot of guitar to mom. And that's how she finds comfort and plays into the theme of self-care. So kind of offering that, using that as an entry point to care for mom to just sit back and relax, let me do the work for you, by using guitar or ocean disc music therapy intervention. So for my own therapeutic disposition, something came up during the sessions. Given that I've been involved in the care process for almost 3 months and a half, sometimes a boundary crossing it could take place in terms of self-disclosure, but I needed to be mindful of maintaining my professional boundaries and ensure our relationship is always the benefit of the patient, not of mine, which I did. And even self-disclosure was intended with purpose to further meet the patient's therapeutic needs. And oftentimes our crossings are really brief, and I'll have a clear return to the established limits of our therapeutic professional relationship. And countertransference also came up when I recognized familiar aspects of the client's story that may be related to my own experience, and specifically how they are in a new city, facing such traumatic medical crises. I moved to New York City last year, and being in a new city with my family has really taken a toll on my own transition. So it plays in a role how the parents disclose their own experience, and it really evokes certain emotions in myself. But it's really important for myself to be mindful of what's my own and what is not, and also my own kind of transferring reactions towards the patient to keep a professional stance and provide a safe therapeutic presence. And another thing that came up during session is presenting myself with authenticity. Although the family, they're English speaking, their first language is Spanish, which is also the language that they're comfortable in. And I took Spanish in high school throughout college. But my Spanish isn't perfect or anywhere near proficient, but I feel comfortable in carrying a conversation. So our session is a mix of both Spanish and English. And at first I thought the slight language barrier would impede the process of presenting myself, fully. But then I realized ultimately that it's not about expressing myself fully, but it's being able to feel and to be with the patient's feelings and thoughts. And it's also about returning to the human innate qualities of being genuine, empathetic, patient, and many more that could really foster that meaningful connection. And moving on to experiential, I've been talking a lot, so I think it's time for some music. I'll be using the intervention ocean disc entrainment for us to kind of have a taste of it. So I'd like you to just get comfortable, sit back a little bit, and just listen to the sound. And take a deep breath And place your feet flat on the floor. Really feeling your feet in contact with the ground underneath you. And just take a few more deep breaths like this for a moment. So I like you to start by focusing on your toes. Scrunch them up and release. Now relax your ankles. Your calf muscles. Knees. And thigh muscles. Remember, let any thoughts you may have float up and away in an air bubble. Now relax your pelvic area. And begin to notice any tension you may have in your back. Breathe deeply in. And as you breathe out, slowly relax and release any tension you may have. Now your shoulders. Lift them up and release completely. Nice. Now it's time to relax your neck and jaw muscles. Take a deep breath in. And as you breathe out, let go of any tension you're holding in your neck and jaw. Finally, the top of your head. I'd like you to hunch your shoulders up one last time to the top of your head and release. Any remaining tension can sink down and flow out of you. Wonderful. Take a few more breaths and enjoy this feeling of relaxation and calm for a little while longer. And just focus on the music. I'd like you to now slowly bring your attention back to the room. Begin noticing the sounds around you. And when you're ready, you can return. Oh, sorry. All right. So this is one of the interventions that we do for parent support to help them relax, kind of like a guided imagery relaxation for the parents. And of course, it's not through Zoom; it's in person, so it might be easier to listen. Next, it's research. So I've highlighted the research that is related to NICU. The first one being the effect of music therapy on vitals, signs, feeding and sleep in premature infants. And that is a complete research. Moving on to the effect of music therapy on neonates diagnosed with neonatal abstinence syndrome. And this is our ongoing study. And you might see us when some infants coming doing some interventions with them. An additional ongoing research and studies is the study about fathers' experience of music therapy on bonding with father-identified song of kin. And this is also an ongoing research. And we have a new research that's not on it yet, but this study is coming out in the coming months that we are in the IRB process of studying ocean disc entrainment intervention and NEARS. And we are co-PI with Dr. Rachel Reed, our neonatologist at Mount Sinai West. These are books. They could be very useful for not just us, but for you to, purchase this and have this in your bookshelf. We provide education and training. These are the symposium, and we, ever since 1997, we have hosted a series of symposium. And this year, we were very fortunate to have John Batiste. He talked about social music, and this was the poster. He talked about how social music is portrayed through songs and sound. These are training programs from fieldwork, internship, fellowship, and so on. These are some of the examples of our extension that we utilize to kind of bring music therapy into a community aspect. And this kind of showcase our department, the patients, the interns, the music therapists. And we oftentimes feature celebrities in our gala. And this is also happening tonight, so feel free to join us. This is one of the posters. And this was when it was live. Unfortunately, we couldn't do it this year, but this is how it looks like when it's live. As for COVID response, we reflect this change of time by going virtual, and we did telehealth with parents in NICU to provide additional support. We also created RIB studies as well as PATH for music psychotherapy for staff. This is our social media. Please follow us on Instagram, Facebook, and Twitter if you have any of them. And if you would like to schedule an orientation observation, you can contact Marie. And if you have any additional questions, you could reach me at my email here. And that's it for my presentation. Thank you. Is there any questions from you guys?
Wanting to be mindful of time, Yen. I have a quick question. I know you created such great relationships with the medical staff, including nursing and a neonatologist at Mount Sinai West, and you mentioned some EMT before. I was curious if you can expand on how you utilize that to form some relationships with them.
Yeah, so kind of asking nurses and doctors what are their favorite songs and kind of, provide that support throughout their day. And sometimes the nurses would sing with me, they'd be like, oh, I know this song. And yeah, using music as a tool to form relationships with the nurses. And I've done songs in Polish and Korean and in Spanish. They were, yeah, it really caught their attention.
How many languages do you speak?
Oh, I only speak three. I only speak English
Oh,
and Taiwanese and Mandarin. I don't speak any of those.
you speak Spanish
Kind of. I'm not proficient, but I do.
pretty well.
And when you think about the beginning of your internship, what was the first big threshold that you felt like you needed to cross? Like what your biggest obstacle to moving into the work was what?
Um, it's a really broad question, and I think I need more time to think about it.
Maybe Lauren.
Laura might know.
Of course, I mean, while I can't speak for Yen's process, I can speak to being a bystander and a witness and her supervisor to help her navigate her internship. And I remember potentially an aspect of Yen's growth in the beginning certainly was some confidence and gaining some tools, again, referencing that adage that we like to use of you can't necessarily write the book unless you know where the pen and paper are. And so finding the tools and feeling comfortable and identifying some coping ways to enter a session and be able to focus out and be present for our clients and our patients was something we worked on. And please correct me if I'm wrong, Yen.
That was valid. Thank you, Lauren. I think we have reached our 45 minutes. But if there's no additional questions, just want to thank everyone coming to my in service.
Thank you.